I want you to know that even when you pee, no matter how much you think you're getting out, there is always some residual volume left in the bladder, and that is totally normal and totally okay. We just want to get the most pee out that we can. How to clear your bladder of urine so you can fully empty your bladder. Now, I want you to know that even when you pee, no matter how much you think you're getting out, there is always some residual volume left in the bladder, and that is totally normal and totally okay. We just want to get the most pee out that we can so we can fully empty, and then our bladder can start to fill over the next 2 to 3 hours. And ideally, we are able to hold a full bladder of urine for 3 to 4 hours. That is what a healthy bladder can do. And this is really independent of how much water you actually consume on a daily basis. I have people that can drink a gallon a day or people that drink 80 ounces a day, and they are still able to make that, able to hold their bladder for, 3 to 4 hours without leaking and without having a ton of urges to constantly go to the bathroom. Now, if you are having a lot of urges to go to the bathroom and they're more frequent than every 3 to 4 hours, a lot of times that means that there's some pelvic floor dysfunction involved. And that would be a great time to come into the clinic and really get a true assessment of your pelvic floor to make sure that you're not getting false signals to your brain that you need to pee when you actually don't have to. This is really common when you like have your key out and you're like trying to get into the door as fast as you can, and you're like, I all of a sudden have to pee so bad I can't even hold it. That means that that's a pelvic floor problem, and usually we need to retrain those muscles of the pelvic floor so they're not giving the brain false urges and then creating that incontinence or that urinary leakage. There's also stress incontinence, which is where you are jumping or running and then you pee. That would be a stress incontinence, and you can have a combination of both as well. And if you have either of those situations, you absolutely want to get your pelvic floor checked out because that is not normal. And we can do a lot of things to get our pelvic floors completely optimized so you're not leaking. And it's really important because even if you don't care that you're peeing your pants, the pelvic floor is a really important part of your deep core muscles. And if your pelvic floor isn't working, which is evident if you're having incontinence or urgency, then that means that you're not able to absorb all the forces that your core should be able to, and you're going to be more susceptible to back pain, hip pain, knee pain, and probably joint replacements in the future. So we want to make sure that your pelvic floor is working completely optimal. So I want to teach you how to pee. When you get the urge to pee, you can typically delay 15 minutes to 45 minutes. And ideally, you're evacuating urine every 3 to 4 hours. When you're pregnant, you might make that a little bit more frequent, 2.5 hours to 3 hours, because you do have a baby growing on that bladder. But ideally, even during pregnancy, that isn't an excuse to have incontinence. You should be continent even when you are pregnant. And so when you get the urge to pee, and you've already delayed 15 minutes, then you can go to the bathroom. Or if it's been 3 to 4 hours, then listen to those urges right away and go to the bathroom. The goal is, though, that we make it to that 3 to 4 hour mark. So that's when we are evacuating and emptying our bladder. Okay, so how are you going to go to the toilet and sit on the toilet? Let's talk about that, because I see so many people in the stalls next to me all the time that have their knees together or that are up on their tiptoes, and that makes it so your pelvic floor is tighter. So then you're peeing through a tightened pelvic floor or a tightened urethral sphincter where the pee comes through, and that makes it so it makes it near impossible to fully empty your bladder. So I'm going to go through positioning and how you should sit on the toilet. When you sit on the toilet because you have to pee, you want to make sure that your knees are about hip width apart. This is typically 2/5 apart, and this is where your pelvic floor can start to fully relax. Now, if you can initiate the stream of urine just by thinking about it, that's great. If not, you might need to wiggle a little bit front to back or side to side, and or you can try to take a couple deep breaths just into the belly, relaxing and opening the pelvic floor, and initiate the stream of urine that way. So that's how you are going to initiate. I want to go back to what I said earlier. We do not want to be up on our tiptoes, and we don't want our knees together to pee. If our knees are together, that means the pelvic floor is going to have a hard time fully opening to relax because we're squeezing or we're just holding our knees together. And that's going to create a harder environment for the pee to get out of. So we want our perfect alignment, our knees in alignment, so our pelvic floor can rest here. And then if you feel like you need to lean forward to get better emptying of the bladder, that's a great position. You can also lean backwards. You want to do what's most comfortable for your body. If you notice that in this position you're having pain or it just doesn't feel right, then your pelvic floor is probably contracting some, and therefore the urine's not going to fully exit your body. So you need to find the position that you feel most comfortable. And then once the stream has stopped, this is a great time to shake your bladder out and rock forward and back, side to side, and then you can stand up. If you notice that you're dribbling on the toilet seat when you stand up, then you need to make sure that you really shake out the bladder, or you do some wiggles on the toilet seat. You can go forward, you can do circles, you can do this way, you can go forward and backward. And all we're doing is we're shaking out our bladder to make sure that the urine fully empties. This will allow you to have a longer holding time between urination. So say I pee at noon, then by the time it's 3 o'clock or 4 o'clock, I can pee again. But if you're only making it an hour to 2 hours between your pee, or even, shy of 3 hours, you're only going like 2.5 hours, then you need to make sure that you can start to increase your bladder capacity. The bladder is a muscle, and it can expand with liquid, and it can hold quite a lot of liquid. And so we want to make sure that we're stretching it out and making it hold. And if you're going to the bathroom every 1 to 2 hours, then you're not making it hold its full potential. So your bladder is gonna just not know how to expand as well. And so you want to train your pelvic floor so that you can really control the amount of urine that you're able to get out and the amount of urine that you're able to hold. So I hope you found this helpful. I'm Dr. Allison Feldt. I own Body Motion Physical Therapy in Washington State, and we help people with their pelvic floors so that they can have complete bladder control. If you're interested, call our clinic, and like and subscribe to this video if you found this helpful. Ask me questions in the comments and I respond to them directly. Thanks for joining me today. I hope you found this valuable. Take care.